All right, so what we want to do now for the last bit of time we have here focused on consumer engagement is we want to talk about how do we take what we've talked about today and make it actionable for you, right? So what action steps can you leave with today to improve or to nurture consumer engagement in your specific agency? Even if your whole agency doesn't have buy-in and it's just you prioritizing consumer engagement, what can you do? What can your team do? What can your agency do? What conversations can you have? What strategies can you work on? We want to spend some time now working on that. One of the worst things that could happen today is if you leave today discouraged about consumer engagement. If you leave today going, well, I can't do any of that, so, right? And there's always that threat of that happening, of us talking about something and kind of thinking about something and people leaving going, well, that's impossible. So we really want to think about consumer engagement from a strengths-based approach, from an asset-based approach, a strengths-based approach. We do this with our clients all the time. So instead of doing what we very often end up doing in agencies that help people and saying, okay, what's missing, we want to think about what are we already doing well? What are we already doing well in our agency? What am I doing well in the realm of consumer engagement? So and when we think about an assets-based approach, we're thinking about what do we already have that's working? It may be that you could already identify some of those patients we talked about this morning, that you already have some patients that in some capacity are engaged and leading, that you already have some staff who are serving as a liaison, that you already have some providers who value consumer engagement. So someone share with me, what are some of the assets that you already have or that your agency already has? What are some of the strengths that your agency has when it comes to consumer engagement? Receptiveness. So do you mean from your staff or your patients or everyone?
The whole fact that we have employees who are placed that listen to us and present us with information that we can then give them feedback on.
Oh, that is an enormous strength, right? So the entire staff is receptive to consumer leaders. They're listening to them. They're interested in what they have to say. That right there is an enormous strength. Whether there's any structure yet, whether there's any accountability yet, if you've got staff who are saying, hey, what do you think? That right there is the foundation that you need. That's enormous. Yes? Budget. Budget is huge. If you've already got something budgeted for this, I talk to a lot of agencies that have set aside money for this, but they're not using it, or it ends up getting used for something else. So yes, if this is written into your budget, that is huge. That is a huge point that we didn't talk about this morning, is that there are health center staff who feel threatened by consumer engagement. And we have to be able to name that. This is something we really struggle with in this field, is that we're always so very special about our language, and we're always so, with very good reason, advocating for people who are marginalized, that sometimes we can't ever say, but you know what, this is hard, right? This is threatening. I'm worried about this. And that's a huge weakness in our field. We've been talking about safety and security in lots of different ways. We've been doing work on safety and security. And the number one barrier that we're facing is being unable to say, you know what, there are safety and security threats in NHCHs. But if we say that, people go, oh no, you can't say that. You're increasing stigma. Like, well, we have to be able to say what's true, right? So same thing with consumer engagement. There are staff in your agencies who may say, great, so now my education doesn't mean anything. I went to school for 6 years for nothing, right? Or, great, I've been working here for 25 years and now no one cares because we're going to ask the consumer. We've got to be prepared to have those conversations and to address that and to say, your education was valuable. Your professional experience is valuable. And lived experience is valuable. And how do we value what everyone brings, right? That's going to be an important part of this conversation. So, when we have to maintain balance, it would be a mistake to bring in a consumer into the operating room and say, tell us where to cut, right? Unless that consumer is an experienced surgeon. In some ways, I have seen agencies that are swinging so far this way that they're asking consumers to inform every aspect of their agency and their medical procedures even, right? Like, what's your lane? Where do you fit? Where's your contribution? And we have to be able to have balance, right? We have to be able to have balance and be able to talk about the fact that some people will feel threatened. All right, so we'd like you to take a few minutes at your tables to talk about what are the strengths, what are the assets of your agency as it comes to consumer engagement. What are you already doing well? Okay? What are you already, what are the key people that are already at the table, right? We're going to take just a few minutes to talk about that, and then we're going to think about developing action steps based on that, all right? And feel free to combine tables or something if you have smaller groups too. What are you already doing well in consumer engagement? Who are the players that you already have? What assets do you already have? All right, so as we bring it back in, everybody looking up here. This is the hardest thing about discussion is then we can't, you may have to yell again. All right, everybody looking up here. Everybody bringing it in. Oh. Every time it's going to be a little, it's going to be a little more aggressive. So someone tell me, what strengths, what assets around consumer engagement does your agency have? That is awesome. That is awesome. I love the, yeah. Should have started with that. I love the listening and being teachable. You know, that's such a huge part of this. Can your staff be taught something by someone who's homeless? You know, do they believe it? we know they can. Do they believe it? Right? Do I believe that? How do we encourage that teachableness within our staff? What else? Oh, I thought you were going to say something.
Oh, no, I was just getting the mic for people that wanted to share from their table.
What else from your table? What assets do you have? What strengths do you have around consumer engagement?
I'm not saying this, it was someone that was at the table that brought up something that I wish we had. And that was that they have political support for their institution, the mayor of their city. So I thought that, wow, if you can get officials who disperse or have the ability to disperse, not only disperse, but guide the views of their constituency and all of that stuff, that has to be a plus. Wow. Mm-hmm. So I thought that was awesome that they mentioned that. And I just wanted to put that out there, food for thought, because we have an upcoming mayoral election, and we're going to need to see who's talking about them people, as they say. Mm-hmm.
Yeah, that's a huge point. Like we said, this is something that can go far beyond your health center. And we're seeing groups of consumers all over the country that are getting together and saying, okay, now health centers come to us, now cities come to us, mayors come to us, and it being completely consumer-led. So I think this is something that can just explode and can inform the political arena too. Yeah, that's awesome. Someone else, what strengths, what assets do you have around consumer engagement? Rodney, are you speechless?
Oh. I know, right? You saw there. Hello. So, hello. Oh, basically, what I was saying with one of the outreach staff is doing outreach with the staff while they're the medical providers, their benefits and entitlement, and other support staff to do tabling and also to recruit, because that's what we do well is outreach. You know, in some of the places where they serve food. Yeah, well, you can find 90% of the people from uptown. So that's what I was saying, and she agreed with that. And so, you know, and other wraparound services to go with that. The people who input people into CE and other wraparound services, drop-in center, the shower and laundry and things like that, enabling services. So yeah, I think that's really, really huge for our agency to build up our build power with our consumers. Yeah.
Yeah, so certainly the services that you offer bring in consumers that then feed the consumer engagement, that's all tied together. So the more services that you offer, the more help people receive, the more consumers you're exposed to in a wide variety of ways. Absolutely. Someone else, what are the strengths, what are the assets that your agency brings to consumer engagement?
Well, at the church, I'd be happy. And then the thing that we bring out to the homeless people. We cook breakfast for them, and we take them out to the movie sometime. And if we don't, and then after they leave, so we give them a $20 gift card and give them a little care bag to take for them later. If like the mosquitoes be hot, or be cold, we give them a blanket. We give them a jacket. So we also let them ride. Sometimes we take them go to the park, have a little barbecue and stuff for them too.
Yeah, absolutely. Again, the more services you're able to bring in, the more incentives you're able to bring in. That's awesome. Yes, sir.
Would you say that if people were just around the room would answer this, would you say that your organization does a good job of humanizing your members, the people you're looking after?
Do you believe that your agency does a good job of humanizing the people that you serve? The people that you serve. And if so, how? How would you justify that answer?
Well, I think it is by showing the compassion and value that the clients and the consumer have, providing training or awards as well. They do support us in that. And then also making sure that we attend events like this to increase our knowledge in the services that are being provided, not only at the clinic, but in the personal level as well.
Are the chair or vice chair of our Health Service Advisory Council. We're invited to the board of directors. We get an automatic vote. There is no like, oh, you don't get a vote, you don't get to hear what's going on. And like the difference between like myself and Mamie, which is the new chair, like I'm invited to go and be her mentor and support her. But she has her voice, I have mine. We talk about things. And the difference when we were talking about boards earlier was like, her introduction was like a little packet. My introduction was a binder of one whole year and said, read it. Yes. But I was the one that said, hell yeah, I'm gonna read it because I wanna know what we are actually doing as consumers to make changes for our HCH. That's why I sit on finance. I sit when HRSA comes in. And also the biggest one that I sit on is the quality and safety of my patients. I call them my patients because I'm that patient. If I know what I want, I don't know what they want, but I'm going to go out there and I'm going to talk to them. I'm going to survey them, and when that meeting comes up, this is what I get to give them, and they listen to it. And then it's brought back to the board of directors. And then next thing you know, I'm getting 4 or 5 calls from board members asking me, what are you talking about, Art? And then I'm like, oh, okay, now I get to explain. So it's not just that vote, but it's that voice at the table. And they listen to our group at a lot of different levels. And that's why that group says, okay, these are the folks that are going to this conference. I've been doing it for a long time. Mamie's in her 4th year. And we just found out that we have funding for like the next 5 years to where if I'm not on NCAB or my national or my cab at home, they're still going to send me because they want me to still be a voice from Central City Concern as that consumer, to keep bringing that information back with Mamie as chair or somebody new as chair. So how many organizations do that for somebody? Probably not too many, But yeah, I just want to put it out that way, that our voices matter at that table all the time, and we have a vote, and we get to block some shit.
Someone else. Yep.
I'm coming. Raise your hand right quick. Okay, there we go. There was somebody here. Charlotte, oh, baby, I'm sorry. I got to go put my eye drops in.
Yes, I didn't speak on my own ACH, but since Art brought that up, one of the main strengths that we have and people have been talking about, I thank that lady right there for bringing up people who operate in the dual role now, that are both. I would love to see a show of hands before I go any further of how many people in this room are now both. Oh my God, isn't that wonderful? Isn't that wonderful? That's applauding. Thank you. But Yes, yes, I'm excited about that. But one of the best strengths that you can have is a foundation, a historian that convey when the changing of the guard comes. They are the mainstay consultant that can give the input that will undergird the continuance of your cab. Mr. Joe say he ain't no token. He ain't no token. He walks what he walks, but he's the historical. So if you have someone like Art, like Mr. Joe, that refuses to go, don't try to run them off. You need to buy into that, and that's for both sides of the coin, for the administrators, for the CEOs, for the consumers, for everybody concerned. If it's working, you need to enhance it. You don't need to get rid of it. So I think that he doesn't ask people to join the cab. He orders them.
Was there one more in the back?
Hey, everybody. The question was, how is your organization doing? Are they humanizing people, or how are they doing that well? So I'm a part of the Flexible Housing Pool, and the Flexible Housing Pool actually has its own separate organization called the LEAC. LEAC is basically what the letters are, Lived Experience Advisory Council. So what you do is you take those things that people are now using that once upon a time was a trigger or a trauma, and you show them how their voice is able to be used. And that is their job. Their job, they have a job just like everyone else. Now, the thing is, when you first start that organization, it's very challenging because people who've had major different, whether it's homelessness or addiction or whatever their issue has been in the past, that is their history. So sometimes it will be hard. If you haven't worked in 10 years, then it doesn't matter. And it doesn't matter if I'm giving you a gift card or, $50 or whatever it is. I still have to teach you how to work. You have to learn a work ethic. So if you begin to put these things in, implementation, and then you make it grow. You give those people a job, you give them a vision, you show them what their vision is, and you tell them what their job is, and then you continue to follow up again. Those things that I mentioned earlier, tell, show, do, feedback. You tell them how to do it, you show them how to do it, but you then have to put them in a position and let them do it. And you do have to hold them accountable. So for me, I think Flexible Housing Pool is doing excellent. I'm sorry that there's so many challenges in the room, but I want to see y'all on some of these calls, maybe from state to state, and try to see if we can help one another in implementing some of these things into the program.
Yeah, absolutely. All right, the last thing that we want to do today, before we do the survey and some last-minute housekeeping, is we really want you to think through what are some action steps that you can make based on what you've learned today. So when you think about consumer engagement in your agency, what's going well, what's not going so well, what players you have from our discussion in the last hour, who's at the table, who's not, how well they're doing, how well they're supported. What are some clear action steps that you can take when you leave here today? Who can you talk to? Who can you inspire? What can you dream about? What conversation do you need to have around buy-in? What can you do going out from here to improve consumer engagement in your agency? It may be that you don't have the impact over your whole agency, but you could have a conversation with someone on your team, or you could change the way you personally are interacting. If the circle starts with you, what can you do differently based on what you heard today? It may be something as simple as the way I think about our patients or the way I interact with them, right? But what action steps can you take today based on what we've talked about? Rodney, did you have something?
Running? Here you go.
Suggestive sell the program to the board of directors through the chairperson that sits on that board. And also you have to promote around the clinic with different on a community board where the providers see some of the patients. And then also coming into the clinic and doing like tabling. And bringing some snacks, that always helps.
Coming into the clinic and doing what?
Tabling.
Oh, okay. Okay.
We have summer solstice coming up, ACH week, all these mentor would say. You can start improving from that.
All right, someone else. What can you go back and do after this?
Mine is more of a question and curiosity if other people in the room have overcome some barriers to implementing a consumer advisory board. So I work as part of the public health department, so government official funded by HRSA for our Healthcare for the Homeless project. And so I'm not even sure what all the barriers are, but I'm just thinking there's probably people in this room that have been creative to make sure that this is possible.
One thing that we've seen, this is fairly new, at least I shouldn't say that, it's new in the council kind of processing this, and I say this because we've had a few health departments that have engaged us around this, is when we've had health departments approach us and say, we don't have funding for this, we don't have the staff for this, but it's really important to us. And so what some health departments have done, and some other maybe, we work with government-funded entities where they're challenged to do this, but they don't receive funding actually to do that, or they don't have staff. It's just kind of like make it happen. Is we're seeing more and more communities. We see this in really rural areas too, where where agencies are coming together and say, okay, I've got a shelter with 3 beds and I have 1 staff member. I can't possibly do community engagement, but I'm going to get with these other 4 programs, and together we're going to form a consumer advisory board, right? Or together we're going to say, well, I have a consumer volunteer that's amazing. Well, I have 2. Well, I've got someone in my program right now. Okay, then can they get together and meet one time? As a very first action step. We're seeing more and more continua of care that are doing this, or coalitions that are doing this. I'm working with a group in New York that's doing this, that's saying, we have a staff of 1, and this agency has a staff of 2, and they are just volunteer-led. But we all want to see this happen. So they're getting together and forming a consumer advisory board. It's very informal. They don't really have bylaws. They more just have meeting guidelines. But they're getting together and still trying to make it happen. Some agencies, to overcome some of these barriers, are saying, okay, us 5, we all have community health workers, or we all have peer support specialists, and they all have lived experience. So what if we form something of a board based of those people that we're already paying? Right? So we don't have to there's some barriers there that we don't have to overcome, like transportation and compensation. We'll just write this into their job description. We really want you all to inform policies and procedures. And so I'm a community health worker, this is my community health responsibilities, and I go to a consumer leadership meeting once a month. And so there can be creative ways around this using the assets you already have. If you already have a group on staff or a group of volunteers with lived experience, how can we make the most of that? Now, there are limits to that, but we're seeing more and more agencies that really value this, but they don't have the staff and they don't have some of the buy-in, and so they're getting together. And I've seen a few health departments that have done that fairly well, is working with other groups to kind of form a patient advisory group. But it's challenging, but I'm happy to talk more about that too. But I have worked with a few health departments who have done that. What other barriers have you overcome and how?
So Cindy, sitting at our table and having a conversation, what came out was that my friend here works for a very large FQHC, and they have the necessary community health workers and the peer advocates. But there are some at the table who work for smaller FQHCs, and they don't have community health workers, and they need to engage clients more. So I just want to piggyback on something you said, because we know we can't do it all by ourselves. Collaboration is key when you're trying to get these things done. I implore you to do what Cindy said and gather, have 3 or 4 organizations who do and the do's and the don't have, the haves and the don't haves, to collaborate so you all can come up with a positive input.
Yeah, kind of thinking through what can we do. We've worked with shelters and agencies that have said, we're going to have a dinner and invite leading, influential patients. And it's not structured and it's not everything it could be, but we learn so much that one night at dinner, right? I've talked to CEOs and others that say, we don't have a patient advisory board and we don't know how to make that happen, but our CEO takes 2 patients out to lunch every 2 weeks. It's so small, right? It's not everything we would want it to be, but it's something. And we learn so much when we go out to lunch or we go out to coffee, right? So where can you start? What's the starting point? And not feeling like I've got to do everything or I can't do anything, right? But I talked to one agency that was like a food pantry, and they did a little bit of like a pop-up clinic kind of thing, and their HR person would go sit in the waiting room and just talk to people one morning a week. That's just pass out coffee and talk to people. Wow, it's not the level of consumer engagement we've talked about today, but she learned so much, right? It was a start. It was something. It opened the door. So what can you do, right? There are organizations that have enormous cabs and would still benefit from the CEO spending some time in the waiting room, right? So what can you do, I think, is what we really want to leave you with today, is to not be discouraged, but to think, yeah, you know what, we could do this, or we are already doing that and we see some benefit, right? So we would like to encourage you as you go out today with a couple of things. First of all, this is something you can do. This is something you can do on some scale, right? Looking for those people, like we talked about, looking for those people and calling out what you see there, right? So we would encourage you as you go out, and as you attend, if you're staying for the conference, and I know probably most of you are, that this would be a time where you dream about possibilities, right? That you dream about what you could do and not get discouraged with what you're not doing. So we really encourage you to do that leaving out today. What could it look like? What could it be? What kind of conversations could you go back and have? Who's already excited about this or hopeful about this that you can go back and talk to? If there are other resources that we can provide, we've talked about our website lots of times. We provide technical assistance around this. So please feel free to reach out to us through their website. You can click on, where is it where you request TA? On the homepage, you'll see a place that says Request Assistance. You can request TA. That goes right to us. So we are really eager, probably not tomorrow, but once we get back home, we're really eager to help, to be as helpful as we can be. So please do reach out. Feel free to email us. Feel free to contact us. We want to know how we can support you in this. We want to hear how it's going for you. We want to hear what hasn't gone well, what's been successful, who listened, who didn't, not like in here today. If you didn't listen, you don't have to tell us that. But who, as you go back home, who's listening, who's responding, what can we do to support you? What resources can we give you to support you? So please go out today thinking about, dreaming about consumer engagement, and let us know what we can do to support you. I know many of you already did the assessment tool. We would love for you to click on that assessment tool and do that. And we would love for you to fill out the survey. So please fill out your survey. You can bring it here to this table, or we'll come around and collect them. You're welcome to stay for the meeting that's going to happen after this. It has been wonderful to spend the day with you. Thank you so much for coming.